Hello, everyone, and welcome to the presentation of the article titled An Online Community of Patients with Psoriasis with Built-in Self-Reported Questionnaires. My name is Lucila Bruchansky, and this is the whole team that worked from Hospital Italiano de Buenos Aires in Argentina. So as an introduction, patient portals are applications that can effectively promote communication of health-related information, thus reducing patient anxiety due to information gaps. We also know that psoriasis is a chronic inflammatory skin disease associated with reduced life quality, and that in this context, information is often not enough to support informed and shared decisions. This affects not only treatment adherence, but also patient outcomes. Also, online communities for patients with psoriasis provide education about the disease as well as psychosocial support. For dermatologic conditions like psoriasis, there are available self-report tools that enable a more comprehensive approach of the disease that takes the patient perspective into account. Well, as you can see here, we have a picture of the community of psoriasis within our PHR. This community of patients with psoriasis was developed in 2019 within the PHR, considering the potential information needs of patients. It includes a section of information for patients, a forum for active participation, a dynamic timeline displaying related events for patients with psoriasis, such as scheduled visits to dermatologists, and also a section that offers self-reported questionnaires on disease severity to be completed by patients. Well, the aim of this work was to describe the online community for patients with psoriasis and also report user interaction with the platform. We analyzed the use of self-reported questionnaires and the subsequent contact with the healthcare system, considering the recommendations triggered by the results of these scores. So this study was carried out at Hospital Italiano de Buenos Aires, that is a tertiary level organization, which covers all health specialties at different levels of the healthcare system. It has its own in-house health information system since 1998, and also it has a tethered PHR since 2007. The PHR has at present more than 400,000 registered users. And some of its functionalities include appointment scheduling, test result visualization, patient practitioner, secure messaging, management of prescribed medication, and different modalities of teleconsultation. For this study, we include users of the psoriasis community who accessed the platform between September 30 and December 30 of 2019. So it's a 3-month period of the study. So here we are back in the psoriasis community in our PHR. You can see that it has 4 validated self-report questionnaires. One is the patient report of extent of psoriasis involvement. The other is a question, the psoriasis symptoms inventory. The other is a dermatology quality of life index. And the last one is the psoriatic arthritis screening and evaluation questionnaire. We use pre-specified thresholds to identify altered questionnaire scores according to the literature. Also, online versions of the questionnaire were designed to be introduced in the online community. Each questionnaire can be filled by the patients once a week, and dermatologists create rules to suggest in-person follow-up based on questionnaire results. Upon completing the questionnaire, the screen shows follow-up recommendations such as we suggest that you visit your dermatologist within the next month if you have not already done so. Also, self-reported test results are available in the patient EHR, and their physician can check them during the consultation. To analyze whether users consider the recommendations of the virtual community, we analyze how many users schedule an outpatient visit during the 3-month period following the implementation of the virtual community. User characteristics and online community access were reported using descriptive statistics, and to compare scheduled outpatient visits among users with and without altered scores, we dichotomized users based on their self-reported scores and considered the proportion of patients scheduling outpatient visits in each group. Going to the results, we included 2,175 users who accessed the online community between September 30 and December 30, 2019. The mean age of users was of 45 years, in a range from 30 to 63. 60% were women. Almost 26 users per day was the number of users that use the community, in a range from 4 to 74. 217 access online questionnaires, and 447 access community forums. And the most visited forums were those related to treatment topics. Here, continue with the results. 97 users complete 240 self-reported questionnaires. The patient report of extent of psoriasis involvement had the lowest rate of use, while the other 3 questionnaires were completed in a similar proportion. Out of these 97 that complete the online questionnaires, 60 users had at least one altered questionnaire score. And this figure shows the distribution of scores for each questionnaire. Here we can see this table from the 97 users that complete the self-reported questionnaires. 12 users schedule visits to dermatologists or rheumatologists. This table shows the proportion of users that schedule visits grouped by questionnaire results, being normal or altered. 15% of patients with altered questionnaire scores schedule outpatient visits, compared to 8% with normal questionnaire results, although this difference was not statistically significant in our sample. So we are arrived to the discussion. We consider that our work has several strengths that include the use of structured user data and questionnaire results, our selection of validated questionnaires, and the interdisciplinary design of the patient community that was made along with the dermatology department. Also, it has several limitations that include the relatively short study period. The symptom severity reported by patients was not verified by specialists, but we try to diminish this problem by selecting widely used and validated questionnaires. So our findings suggest that there is a relatively low adherence to recommendations issued by the PHR. These findings are similar to other studies that report this lack of impact on healthcare outcomes. And as an example, this research report that PHRs are considered valuable conduits for patient self-management. However, they often fail to prove measurable impact on healthcare processes and outcomes. So in this case, further studies are needed to explain the reason for this phenomenon. we can say that a lot of work needs to be done in this direction. Finally, as a conclusion, in our sample, we did not find a significant association between reported disease severity by means of the questionnaires in the community of psoriasis within the PHR and the subsequent visits to specialists. But we know that online communities for patients with psoriasis provide education about the disease as well as psychosocial support. Thank you very much for your attention. This study was carried out under the residency program in health informatics, the consumer health informatics area, and the Department of Dermatology at Hospital Italiano de Buenos Aires in Argentina. Thank you very much again. Have a nice day.